The elbow, wrist, and hand exercise I'll be discussing is rhythmic stabilization in push-up position. This is part of the functional strengthening and proprioceptive training phase. The exercise prescription would be 2 to 3 sets of 15 to 30-second holds with perturbation. This would just depend on some of the below that I will describe. So progression could be increasing perturbation intensity and duration. You can also decrease the athlete's base of support by progressing from a kneeling position to a full push-up position, which you'll see that I'm in, and eventually to more challenging positions like single arm or single leg plank. You can add movement variations by incorporating dynamic movements like lifting a hand or foot off the ground while maintaining stabilization against the perturbations, or perform the exercise on a less stable surface like a Bosu ball or a balance pad. You can also do the perturbations in different directions, faster, slower, and at random to enhance the need for rapid neuromuscular adjustments. In terms of progression, you can do reduced perturbation intensity, perform the exercise against the wall to reduce the gravitational challenge, and decrease exercise duration and just have a wider base of support. You don't discontinue when pain is greater than a 3 out of 10, if numbness and tingling occurs and cannot complete, or if moving on to a different rehab phase. Progression would be when exercise can be done perform in current position sets and reps, and no discomfort or pain occurs during the exercise. In order to set up in this position, you can start in a kneeling position or a half plank where you're on your knees instead of your toes. This reduces the load on your arms and allows for more controlled movement. For an extra emphasis on elbow stabilization, this exercise can be performed with the elbows bent at different angles, and you can start with a less bent position, which is like the more extended that I'm in, and gradually increase the bend in your elbows to challenge it more as you get comfortable. For wrists and hands, you can focus on the placement and pressure distributions. Your hands should be flat on the floor and fingers spread and equal pressure distributed between the palms and your fingers. You can also try to slightly rotate your hands inward or outward to engage different wrist muscles. Lastly, your partner will apply gentle pressure and controlled perturbations to your upper arm or lower arm near the elbow. This shifts this shifts the stabilization requirement more towards the elbow, wrist, and hand muscles. These perturbations should be less forceful than those applied to the core stabilization. This exercise is extremely beneficial as it not only involves the wrist, hands, and elbows, but it also targets core stability and shoulder stabilization. I will say though, if you're doing this to place more of an emphasis on the latter, then the patient positioning and placement of perturbations would differ. But in this case, since it is an elbow, wrist, and hand exercise, this is how it's done. Thanks.